What we tend to see with adults is periodontal disease and cavities. Cavities meaning that as we get older, we tend to lose some of the bone around our teeth. And so what seems to happen, or what tends to happen with our older patients, is we seem to get cavities that occur at the base or the root of the tooth or at the neck of the tooth. It's called cervical caries. And many times the reason that this is so prevalent is because the enamel is much thinner in this area. And in some cases, as the bone erodes away, there's parts of the tooth exposed that does not naturally have enamel on it. It has a substance called cementum, which is the outer portion of the tooth that is usually under the gum tissue and encased in the bone. And then as time goes on with some patients, you wind up, that actually is exposed. So it's very important for patients to maintain those areas by proper brushing, by flossing, and by using the techniques their dentist shares with them, or their dental hygienist would share with them, in order to prevent and hopefully prevent problems from happening with the teeth as we get older. And that's the great thing about the procedures that we have today, is we have more and more people that have their teeth up to their 80s and 90s. And so much of that is due to the fact of the advances that have come in dentistry, but also to the education of the public, and knowing how to care for our teeth, and knowing that now that we have therapies and that we have means that we did not have 10, 15, 20 years ago to save teeth. And that's great, because what it does is allows those people to be able to maintain their diet, to be able to eat the foods they want to eat, as opposed to having dentures and things such as that, where they only are able to eat certain foods, or they're very self-conscious that their teeth are going to fall out. I mean, they may, if a patient that has teeth that are not their own anymore may have lost self-esteem. So we feel it's very important to maintain our patients' teeth, and to give them that self-confidence that they need. There's probably now more things available than there ever been. We have everything now available depending on the situation. We have bridges. We have bridges that have metal-based bridges. We have bridges now that can be made in certain cases that are all porcelain restorations, or what we call resin and hybrid type bridges. We have implants. In the last 10 years, implants have been incorporated for many patients in the past that were not able to, they maybe have had full dentures or had artificial teeth, that have been able to come back and have implants placed where they can enjoy teeth that are not removable, that they can actually eat the foods that they ate years past when they had their natural teeth. So there are many, many things that have evolved in dentistry with all the new research and all the new developments. So there are many, many treatment options now that weren't available in the past for patients that may have teeth that are non-restorable.